What strikes me the most is that you call yourself a hybrid cardiac surgeon.
So I did an interventionalist work and I did an open work, and the patient is already back on the ward today as we speak.
That's great.
In less than 24 hours. It is not what we can do, but what we must do and what is right for the patient. Especially for the ones who are looking for fellowships, you go to one quality meeting, whether it's international if you can afford, or if you can go to even national, because a lot of international doctors also come to Indian conferences now. There have been fellows who look fantastic on paper, but they're absolutely useless when they come. Do not know how to put a basic cannula, basic stitch. But for a patient, it's once in a lifetime experience. Think that your fellowship is over.
Right.
You're not going to get any more hands-on. That changes your life.
There's one thing I also learned in trauma center is when something is not going right inside the room, then you just take a pause.
Probably I would add another point. A surgeon needs to have humility. That's why I said patience in the OR is of utmost importance.
Hello everyone, welcome to Delhi Docs, जहाँ white coat सिर्फ कहानी की शुरुआत है. Taking a cue from your huge demand to bring a cardiothoracic surgeon, I have actually brought a very, very unique person. He is Dr. Niranjan Hiremath, a senior consultant in Apollo Delhi. He is a cardiac surgeon as well as a vascular surgeon, so a hybrid surgeon actually. And he is the force behind the Apollo Aortic program. So let's quickly dive into the podcast and welcome him. Thank you, sir. Thank you for coming to this podcast.
Thank you, Naman. I've been seeing your podcast and you've been doing a fantastic job. So I'm excited to be here.
Thank you so much, sir. Thank you. Sir, when I look at your CV, there are so many things you do, but what strikes me the most is that you call yourself a hybrid cardiac surgeon.
Yeah.
So what exactly do you do and what is a hybrid cardiac surgeon?
See, about 10, 12 years ago, when the way cardiac surgery, at least when I was when I had finished my PG, and the way cardiac surgery was looked at was a so-called dying branch. And it was like the fad word. Everybody would say, cardiac surgery is dead, angioplasties are here, stents are here, there's no role for a cardiac surgeon eventually. And then transcatheter aortic valve replacement started coming into place.
Right.
Then they're like, there's nothing much for a surgeon to do. But now hybrid cardiac surgery is a surgeon who can do interventions, who can do open heart surgeries, and has a good perspective about how each therapy works well for a patient. And basically it gives a unique perspective at looking at patients' problems from a unbiased view. Like, I will not look at a patient only from an interventionalist point of view.
Okay.
It's like if you're a hammer, everything is a nail.
Right.
That happens to all of us.
Absolutely.
If I'm a surgeon, I can say I can operate on a 90-year-old. I can operate on a 20-year-old. It is not what we can do, but what we must do.
Right.
And what is right for the patient. It's always patients first, and patient is at the center of your decision making. So I worked on how I can evolve myself into a specialist who can think from both aspects. And that is where I would call myself blessed or lucky that 12 years ago, when I finished my PG, I wanted to get into a super specialty program. And I happened to get into a vascular surgical program as a registrar, and then followed by a fellow under, amazing vascular and endovascular surgeons. And I learned the skill of using wires and angiography and cath lab equipments.
So that's the part of a vascular surgery.
Yeah, that is actually part of vascular surgical training.
Okay.
And vascular surgical training entails both open surgery as well as interventional surgery.
Okay. So what the cardiologists do, that's also part of vascular surgery, or that's something else?
Cardiologists, see, all these cardiologists, vascular surgeons, interventional radiologists, and cardiac surgeons, we all overlap in a certain way.
Okay.
Which means if a patient has a problem which can be, or maybe 50% can be dealt with intervention, 50% can be dealt with open heart surgery, then you need involvement of 3 or 4 specialists to make a decision. And everybody will look at it from his or her own perspective.
Right.
Or the primary consultant under whom the surgeon is, he tends to depend on these other specialists to give him an opinion.
Okay.
But in vascular surgery, luckily, the way the branch is and the way it's evolved is that you do both open surgery as well as endovascular surgery or interventional surgery, which also overlaps with the cardiologist. Cardiologists also do that.
But cardiologist doesn't do the open surgeries.
No, they
vascular.
don't. They don't do open surgeries. So we do open surgeries as well as this, and we predominantly do as a vascular surgeon. You predominantly do peripheral vascular work like femoral arteries, limb arteries, carotids, and those kind of things. And of course, endovascular work of the aorta. That's when I developed an interest in aortic surgery. Because I felt that as a vascular surgeon, we were being limited above the diaphragm. And a lot of pathologies originate above the diaphragm. So it's important to have knowledge of everything.
Okay, sorry to interrupt, sir. So vascular surgeons deal with the peripheral vessels, and the cardiac surgeons
deal with the heart and the above the diaphragm aorta.
Okay, and you as a hybrid surgeon,
I do everything.
You do everything, and you also do open heart surgeries. Oh, you are the true CTVS surgeon.
Yes.
Okay, wow, that's great. But what happens with the most of the surgeons? Like, they really limit themselves to the C of CTVS or V of CTVS?
Yes, that is what has happened. The way the modern CTVS training has become, now it's more of CTS, cardiothoracic surgery, and vascular surgery has become a separate specialty. And slowly even thoracic surgery is separating out. So we have thoracic surgeons, we have only cardiac surgeons, we have vascular surgeons.
What does a thoracic surgeon do?
They deal with the lungs and mediastinal pathologies.
So you also do that?
No, I do not do that.
Okay.
So I only do cardiac and vascular. So the reason I call myself hybrid surgeon is when I did vascular surgery, developed interest in aortic surgery, I decided that I will do MCH cardiac surgery because I was interested in the cardiac and vascular system of the aorta and the heart. So that I looked at it in that way and trained myself in such a way that eventually I became a cardiac surgeon who can perform open heart surgeries on one hand and can also do interventions on the other hand. And sometimes in one patient in one sitting, I will do everything.
Wow. Sir, do you have an example for us?
Yeah, definitely. So just yesterday, for example, there was a patient who had a saccular aneurysm of the aortic arch, which is basically dilatation of the aorta at the arch where it curves and goes behind the body in front of the vertebra. So there he had developed a 5.5 centimeter aneurysm. That is in a very precarious situation there, location there, because you have all the brain vessels coming from there.
Okay.
So this can be dealt with open surgery, or much safer option is an endovascular surgery. Okay, you avoid sternotomy and you just have to put a stent inside. The stent excludes the aneurysm.
Got it.
But in order to cover it, you'll have to partially cover some of the neck vessels, the vessels that go to the brain and the hand. In order to revascularize that, I had to make a small cut and do a small bypass. So that's an open surgery.
Okay.
And I put the stent within those 2 hours of doing the procedure. I put a stent as well. So I did an interventionalist work and I did an open work, and the patient is already back on the ward today as we speak.
That's great.
In less than 24 hours. And that's the beauty of being a hybrid surgeon, that you can do. Otherwise, in other scenarios in our country where not many centers are equipped with modern technology, they do the open first. They wait for 24 hours or maybe even few days, and then another interventionalist will come, or a radiologist will come, or a vascular surgeon will come. Then he will do the stenting.
Okay. And there has to be a good coordination, because
absolutely availability, logistics, coordination, money,
and the trust in the open surgeon, and the open surgeon should have trust in the endovascular guy. And the outcome will actually depend on both the skill sets.
Yes.
Oh, that's crazy.
So whereas for me, I could do it in 2 hours. The whole thing was done and the patient is sorted. See what it does ultimately at the end of the day. Who benefits? The patient benefits, which means the patient need not come back to the hospital again. He's already out of the ICU. The procedure lasted only for 2.5, 3 hours.
Right.
And the patient will go back home or get discharged on day 4.
So why do you think there aren't more hybrid surgeons like you?
I think there was a change in the era
Okay.
around, I would say, 10 to 15 years ago. Early, the older generation CTVS surgeons would do everything but more of open surgery. So, open thoracic, open cardiac, open vascular surgery. They would do all the three as open surgeons. They would
Okay.
expose anywhere from any part of the cardiovascular system
Got it.
and the thoracic system. But then, as more and more cardiac surgeons started coming into play, more people trained, there was a saturation in certain areas. And then it was difficult to focus on multiple aspects of CTVS. So
Okay.
people wanted to, instead of being a jack of all trades, the era of being a master of one came into picture.
Right.
And this had already started in the US or the Western countries. There were already exclusive advanced vascular surgeons, exclusive advanced hybrid surgeons. There were, aortic surgeons started coming into picture 10, 15 years ago.
So when I look at your CV, I try to superficially dissect it. I see a lot of paradoxes. One is that you are the one of the youngest surgeons doing complex aortic surgeries in the country,
Yeah.
and at the same time, your training is probably one of the longest.
Yeah.
You finished your MS in 2011,
Yes.
and after 14 years of training, you are still the youngest person. So, sir, the training is too long, right? Or is it not that long to become the youngest? I don't know.
So I think it's attributed to my vision that, or my ambition that I had right from the beginning. Like, in fact, the only reason I wanted to be a surgeon is I wanted to be a cardiac surgeon. This is even going back, during my MBBS days, when I thought, if at all, what PG am I going to do? It's going to be surgery. And that's because I wanted to be a cardiac surgeon. And
Okay.
somewhere along the line, the idea towards the end of my MS general surgical training, it fell off because I was told cardiac surgeons are redundant, cardiac surgery
Right.
doesn't have a future. And I was like, okay,
Absolutely.
maybe. And then destiny played a role. I became I got into vascular surgical training. I developed interest in aortic surgery. I did cardiac surgical training. And then I decided that, to be a comprehensive, mm, surgeon in one particular field, or try to gain mastery in one particular field, you got to put in the years of work, dedicated years of work and training. It's like how a shoemaker, a luxury shoemaker, or an excellent shoemaker, um, works with one particular, um, what to say, master, and for many years, and trains himself and becomes a master himself. So that's
Right.
exactly what I embarked in my life, and that is why it's so many years of training. And of course, everything doesn't go as per plans.
Exactly. I
There's
was.
always going to be
Yes.
detours, there's always going to be
Right.
hurdles. And eventually, for you to say that, okay, now I'm ready, there's no moment where you're going to have enlightenment. It is only how gradually your confidence builds with each fellowship, with each year of training. And then you feel that, okay, I think I can start operating individually, without supervision and safely. And that's when the transition comes. But unfortunately or fortunately for me, it took so many years.
Yeah.
And looking back, I think it built me, and what I'm able to do today.
Yes, one thing I also learned in trauma center is when something is not going right inside the room, something is looking bad or not going
Yeah.
right, then you just take a pause, small pause, think about it, and then you start. When you start working again,
Yeah.
operating again, then it's a different thing completely. Your perspective changes, the outcomes change, everything
I
changes.
completely agree with you. And another, probably I would add another point, is humility. A surgeon needs to have humility. Humility in front of patients, humility in your, when you're talking to your teammates or your junior colleagues. The reason being, we cannot be the best and know all and end all.
That's true.
Everybody can have an input which could, change the game. So we should be humble enough to listen to our junior colleagues, because their ideas could be fresh, their ideas could be fantastic. better than ours. There's nothing wrong in that.
Sir, you have a long list of trainings, not just in India, but I think across the world, all the
Yeah.
continents you have probably covered. Do you think Indian fellowships are at par with the international fellowships, or they are subpar?
They're not, I wouldn't call it subpar,
Hmm.
but our training is not structured. So it's a very, learn on the go kind of a training that we have in India.
Okay.
Because we have high volume
Hmm.
and we learn on the go. We learn through experience. But sometimes that may not be the right way to learn. It's
Right.
got to be structured. What I mean by structure is like if you go to a fellowship with a certain goal in mind, like let's take for surgery for that matter of fact. If you're going into a center where you want to learn a particular type of surgery, but then they're just doing high volume work and they're just operating, and you go on seeing the cases every day, and you come out only as an experienced surgeon, but you don't come out as a completely educated, well-rounded surgeon because the structure wasn't there. Maybe
Right.
you should have had done 15-20 cases hands on. Maybe you should have done 15-20 case plans. But what happens is you only did hands on, no case planning, or you only did case planning and no hands on.
No hands-on. Yeah.
If you're lucky, on good days you will see the best cases possible. Maybe you pick up. So you end up leaving it to luck. You end up leaving it to
That's true.
at being at the right place at the right time matters. So if any of those don't align, then you don't
Yeah,
have
and
that
if you
extra
are two
training.
fellows, then also it's a struggle. If you're
Exactly.
two fellows in the same fellowship and there's a rare case,
Yeah.
happened with me a lot,
Yeah.
then it's a struggle. You have to really fight for that case.
Yeah. So, it's important to identify the kind of centers as much as possible that you can have structured. Unfortunately, in India, that wasn't there, at least back when I wanted to start doing my fellowships. Other branches had, other doctors had,
Okay.
but they were very far and few in interventions or cardiac surgery per se. There are mentors, they'll teach you, but it's not really structured. So you may be, when you finish a fellowship, you may be lacking in certain aspects, and that you will end up figuring it out yourself during your practice, which is a risky proposition.
Which country fellowship did you enjoy the most? So you have been to Australia,
Yes.
you have been to Canada,
Yeah.
you have been to US,
Yes.
you have been to Middle East also.
Yeah.
Okay. So did I miss something?
No. I would say the best training in terms of training I had was Canada.
Okay.
The way it worked for me is since I had already done double super specialty in India, which was total of 5 years of super specialty training, MCH plus fellowship in vascular surgery.
Okay.
I was already a well-rounded super specialist, but the knowledge was all there, just like I mentioned now. But it was not structured in my head.
Okay.
The skills were there, but not the perfect application of those skills. So what fellowships did, it gave me the perspective of how to organize those skills and thoughts and streamline them.
Right.
Otherwise, you become a haphazard, like what if this may work, this may work. You become a guessing kind of a surgeon. To streamline those thoughts, it's important to have these fellowships. And Australia, I did a fellowship. Then I did, I worked in the Middle East where I worked on research work. I was part of the Gulf left main coronary artery disease registry there.
Oh.
So we published a lot of
Okay.
work on coronary artery disease in Middle Eastern patients. It was part of a conglomerate of 7 countries. So I was part of one of those investigators. And then, so I worked a lot on research work there. And then in Canada, it was more of how all my skills and my training came together eventually, and like a cherry and icing on the cake, so to speak. Albeit it was the hardest training I've ever had
Oh, wow.
in terms of work hours, in terms of quality, demand of quality from me, documentation, learning the system. So it was one of the hardest fellowships. But I would say today, what has made me a well-rounded surgeon is the Canadian fellowship.
And after that, you were able to set up this first of a kind or one of a kind
Correct.
Aortic Center
Yes.
in Apollo.
Yes.
That's great.
So this aortic center is basically, there are a few aortic centers around the country.
Okay.
But again, you have 3 or 4 different specialists doing, coming together and working. But here it's one physician who can do interventions, who can do open heart surgery, who can do open aortic surgery, who can do, even peripheral work to a certain extent, all under the one roof with one physician who can get a broader perspective of things and the best option for a patient. So that was my goal, and this is one of its kind.
So I think fellowships are absolutely important, right?
Absolutely.
And it's better to go outside at least for a few years.
See,
What's your opinion?
Yes, I think that's a great question, especially for us Indians, or anybody for that matter. Even there are a lot of trainees in Canada or US who travel to different countries to get, like, they travel to Europe, or they
Okay.
travel to UK, they travel to Germany to get some training, because every system is different and it teaches you something.
Okay.
I was always clear. One thing I was always clear, that if at all I go for a fellowship, I need global training and I want to come back. Get a global perspective of things. Sometimes what happens, you go to only one country, you'll only learn that system and you'll come back, which is not a bad thing. It's very good. But then if you have an option and you have the time, then try to go for two different fellowships in two different countries, because the patient subset is different, the practice is different, approach is different,
Right.
the culture is different. So it makes you a well-rounded surgeon, and that was my aim right from the beginning, that I wanted to be a well-rounded surgeon who has a global perspective, but how to apply that to our Indian scenario. We always have this thought in our mind, maybe, especially for laymen, they think that medicine is better outside Western world. Maybe surgeons are better. Maybe quality is better. So I always had it in my mind that, we should remove that separation of, and that tagline, that Indian surgeons are not up to the mark or whatever. So I always wanted to come back and do the same kind of work I was doing there.
Yes.
Which is what we are doing now.
So, sir, my experience was a little different. As soon as I landed in Germany, every Indian I met said the Indian doctors are better than the German doctors.
Yeah.
And every Indian guy from any Indian community, whether it's Gujarati, it's Punjabi, any community, they want to meet an Indian guy as a doctor, because probably we talk more, we explain more, and that's so much in contrast with what the underlying thinking of almost every person in India is.
See, culturally, we as Indians, we are taught humility, how to respect elders and gurus. Okay. And then we are exposed to high volume work in our training days, in our MBBS days.
Right.
And a culmination of all these three things makes us, why Indian doctors are more sought after outside. I completely agree with this, because our experience is much more than any of the Western countries, especially in the early training years. And the experience is something which cannot be bought, or it cannot be taught. It only comes with the place or with age.
Right.
Yeah. So that is why we are, and that's why I'm saying that when Indian doctors go abroad for fellowships, it rounds them up nicely to become, it sets them up nicely to become great surgeons, physicians, or interventionalists.
So this is for our audience. What exactly is a fellowship? Can you just quickly describe?
See, fellowship cannot be a substitute for your basic training. Fellowship is advanced training usually. Like, for example, if you've already done a basic post-graduation degree and a super specialty degree, it's because technology is constantly evolving. There are certain things which are available abroad, or maybe our country has it now, but we don't have the training yet or the exposure yet. That's where fellowships come into the picture. So you go for fellowships only to top up knowledge.
Right.
It is, to a certain extent, it's additional training, yes, but it's more of topping up the knowledge. It's like giving shape to your training that you've had, giving a form to it. That's what fellowships do.
Do you think there is a minimum time for a fellowship? For example, you should only apply for 6-month fellowships or 1-year fellowships?
That's a fantastic question. Actually, I cannot say that one advice of fellowship fits for all branches. Let me talk from my perspective, that is cardiac surgeon's perspective, and there are a lot of young cardiac trainees who want to know how to embark on fellowships and what happens. See, certain branches, 6 months fellowships are more than sufficient. Okay, especially the not so complex surgeries, for say maybe a urology fellowship or those kind of fellowships.
Right.
Short term fellowships are okay. It also depends on how many years of training you've had before or how much experience you've had. Now, if you've done a postgraduate degree and you've worked for 3-4 years, you don't really need 3-4 years of fellowship again.
Okay.
You just need 1 year. But for any surgical fellowship, I think 1 year is a sweet spot.
Right.
Because if you're going outside India for a fellowship, to learn the culture, to learn the system, the working system of the hospital where you're going, itself takes 6 months. At least for me, it took 6 months.
Yes, yes. For
And
me.
then because there's a lot of digital documentation abroad. In India, we still are yet to catch up with digital documentation.
And another thing, I think, sir, we are hesitant as Indian. At least I was. For the first 6 months, I really didn't ask questions.
Yeah.
I was standing in the OR just quietly.
Yeah.
And I was expecting that he might tell me something.
Yeah.
And if he doesn't tell me anything, I would not ask another question.
That's the biggest difference between Indian fellows and Western fellows. Western fellows are trained to only question.
Right.
Literally.
Yeah.
And the more they question, the more they are respected.
Yeah.
It's the other way around here. The more questions we ask, the more silly we sound.
Yeah.
And having said that, the culture is changing. But at least, back when we were kids, it used to be like, come on, don't be a talkative person. Don't have to ask so many questions. Go read and come. And
Go read and come back. That's the standard.
But, that's not the way. But abroad, in fact, I personally faced that problem. When I went abroad, because I was not asking questions, just like you mentioned, we were looked at as dull-brained people.
Absolutely.
Who are not interested in the fellowship. Who do not have anything to learn about.
Or add.
Or arrogant. Probably he thinks he knows everything. But unfortunately, that is the kind of culture we come from. But when we go there, that's the perspective we get. And that's when we start thinking. Because asking questions keeps you thinking. It could be the craziest questions. But
yes.
among 100 crazy questions, there could be 1 ounce of geniusness.
Yes.
That can come out.
So yes, that's a good tip. I want to I want to give to everybody.
Yeah.
Ask questions.
Ask questions. Be free and respectful to your mentor. See, asking questions and being free with your mentor, at the same time being respectful, there's a line that comes in between. So asking questions or directly or talking freely to your mentor doesn't amount to disrespect.
Yeah.
Depending on how you frame it. So learn that aspect of it. But otherwise, I think the newer generation, especially the younger doctors, should start asking questions so that you start thinking better.
Yes. So coming back to the duration of a fellowship.
Yes.
Yes. So what's the conclusion,
Yeah.
sir?
So 6 months to 1 year,
Yeah.
but 6 months for certain fellowships, but so, maybe specialties like neurosurgery, orthopedic surgery, or cardiac surgery, you need at least 1 year. For cardiac surgery, I would say fellowship should be at least 1 to 2 years.
Right.
And say in cardiac surgery, we have minimally invasive fellowships. We have robotic cardiac surgery fellowships. We have aortic surgery fellowships. We have heart transplant fellowships. These are, very nuanced fellowships where there's a lot to learn. So for such programs, 2-year fellowship is pretty good. Now, for me, it took me some time to find a center where I could learn everything under one roof.
Yes, that's my next question. How to find a good center?
Correct. So, let me finish what I was saying.
Yes.
That, if you find a center which has everything under one roof, who do all kinds of work under one roof, like if a comprehensive heart transplant fellowship, a 2-year fellowship should be more than enough. You don't have to waste your time to do multiple fellowships.
Right.
My journey was different because I wanted to do cardiac and aortic surgery fellowship, which is what I did in Melbourne, Australia, and that was good enough fellowship. But then my research work was lacking. So when I went to Cleveland Clinic in Abu Dhabi, I did a quite a bit of research work, came up with original articles, original surgical techniques that I was able to publish thanks to my mentors there. This is where mentors come into the picture, where they put the trainees and the junior colleagues in the front.
Yes,
You know,
yes,
that's a
yeah.
quality, that's a rare quality, and that's what mentorship should be like. And they give credit.
Absolutely.
See, you don't have to ask for credit as a mentor because credit automatically comes to you,
Right.
right? And then eventually Canada was a more well-rounded, and I wanted to learn TAVI and more of interventional aspect of it. So I had to travel to multiple countries. But now, for example, in India, now that I'm here, I may soon start a fellowship, a 2-year fellowship, where I will teach all of this that I learned around the world.
Wow.
So if you are a center like that, 2 years is more than enough after cardiac surgery, and then you're good to
Absolutely.
go.
Yeah. So any cardiac surgeon applying through Delhi Docs, please give him preference or her. Yeah.
Absolutely. No.
Yes. I wanted to ask how to choose a center or a country. Is country more important? Center more important? Professor is more important? How to navigate this? Because the world is so small now. There are so many options available across the world.
Correct.
How to find a good fellowship center?
See, for that, try and attend a few good important conferences.
Oh, that's a great trip. Yes.
Yeah. So once you attend conferences and you identify the talks that you want to attend, and you will see professors from that respective country or center present their work. And in that, you get to know what is your area of interest and the quality of work that is being done. And then you approach that professor after his or her talk, engage them in a discussion. Also, let them see what you know about what they are doing. And that becomes a stepping stone for you to progress, to ask that, can I apply for your fellowship? Very politely, not hounding them and not saying that, not going right to them and say, I want to apply to a fellowship. Doesn't work like that.
Right.
Okay. So attend meetings, identify like national or international meetings. My sincere suggestion to modern junior colleagues or fellow colleagues is that go to at least one quality meeting in a year. Okay. Especially for the ones who are looking for fellowships, go to one quality meeting, whether it's international if you can afford, or if you can go to even national, because a lot of international doctors also come to Indian conferences now.
Yes.
So identify a good conference, a quality conference. Networking. That is where networking comes into the picture. Have your CV in hand in your email, updated CV. Okay. One of the most commonest complaints all of us in India have, that we don't have enough publications.
Absolutely.
Now, it's very easy for me to say, no, just have more publications. It doesn't work like that. Because again, it comes down to structure, it comes down to interest, mentors, so many aspects of it. Instead, what I would say is try and have publications, at least one or two, but try to have quality publications, even if it is just one or two. But on your CV, highlight your strength. Okay? Because that strength could be the quality that fellowship director may be looking for.
Okay.
See, every fellowship or every mentor says only one thing. I can teach you the skill, I can give you the knowledge, but I cannot teach you the attitude.
Oh, got it.
So you got to have the attitude and the willingness to say that this is my strength and this is what I am willing to give for the fellowship. It's always a give and take.
So how do you understand your strength, or
it's something you have to figure it out in your earlier days, in your MBBS days. Like, for example, I knew that I could do a decent job with suturing. Even if I would, to my junior surgeons, I will tell that even if I'm suturing a skin, I take pride in suturing the skin. I take a pride in how the scar heals. If I do a dressing, I take pride in how the dressing looks. Take pride in every little task you do, and that's how you start identifying your strengths. Okay, maybe I may be a good surgeon. I'm enjoying this particular aspect of it. Maybe you enjoy working in trauma center. Maybe you see that, such crazy complex cases are coming, and maybe you are, this is your calling. So you have to find your calling. It's difficult, but the sooner you find your calling, the better your future, because you will know which direction to go in.
So we talked about how to find a center and a fellowship, and you mentioned that one great tip is networking,
Yeah.
especially in big conferences, national or international, at least once a year.
Yeah.
Every colleague should do this networking. So one is that tip. So now that we have identified and maybe highlighted our CV as well, how to apply for it, how to go about, really cracking the fellowship code.
See, we must remember
Hmm.
that, like us, there are hundreds, if not thousands, applying for a particular position.
Absolutely.
So your first job should be, how do I stand out?
Okay.
Okay. So if you get a chance to directly meet the fellowship director or the program director, that's excellent. You get a chance to make a one-on-one impression. But majority of the times it's online that we are looking. Google is your friend. You have to Google and do your research.
Okay.
Not just page 1 of Google, go up to page 10 of Google. That means every page there will be probably advertisements which are, or positions that are unfilled for a long time. In page 3, 4, they get pushed down in the order of date of updating the job position. So look into Google. I found all my fellowships on Google
Okay.
up until now.
How many emails did you apply? Did you send
Yeah, I
to
have
get
a-
one reply? What's the ratio?
I've got, I would say, to get one reply, the average is about 10 emails.
Okay.
But overall, till today, I've sent about 25 emails.
Oh, that's not a lot. That's
Yeah,
not a lot.
yeah.
Yes, yes.
25 emails, but quality emails, and I've identified the centers. So I did the way I structured it is, I first did my research. You first identify which centers have reputed programs. Now they'll have maximum number of applications. Then you look at so-called tier 2 programs, where they are new and upcoming programs, where they're looking for fellows. The chances of getting fellowship is easier. So that ways you get an entry into the country, and you get noticed. You get a chance to get noticed, and you also learn, the early stage of adaptability in that country is taken care of by getting into any fellowship that you get. Like, of course, your branch and your interest.
Even an observership, I think it leads to a better fellowship. It can lead to at least.
I'll come to that point, because that is a different pathway and how to go about it.
Okay.
But you identify which programs you want to, and start writing to them. You highlight your strengths, highlight what you want to learn, and also highlight your exit plan.
Okay.
Now, nobody will like an applicant who looks like he's latching onto them just to take a green card or just to take a citizenship of that country.
Oh, wow.
So never make your CV or your thing look like I'm looking at a bright future in United States of America or Canada or Australia, because nowadays the ministry or the government doesn't encourage such immigrants.
Okay.
So always highlight an exit plan in your letter, in your email, saying that I want to pick up this skill from your center, and I want to come back to my country or to my center or to my hospital, and I want to implement these practices. That sounds much more conducive and looks like you are here to learn and not to latch on to get a PR or a residency somewhere.
That's a great point. Yes.
That's very important. And this is one of the most commonest reasons for rejection also. If they get to know that you are just applying for a position because, say, your spouse is there, so you're trying to get in, because you want to be there, you want to apply for PR, you want to apply for green card, albeit you go there and do whatever you want, however your life is. But at the same time, it's important that, we have to think from their perspective. And they want somebody who's interested in learning the skills and not to trump them and try to get into their department and become their senior or head of the department or director. Nobody's going to encourage you that.
Okay.
Right? So you highlight why you want to be in that program and what is your exit plan.
Okay.
And coming to observerships, if you don't have enough opportunity to attend international meetings, you don't have enough opportunity to write emails, or maybe you're not getting replies from anywhere, observership is a great option. I personally did an observership in Texas Heart Institute, where there is a very famous cardiac surgeon, aortic surgeon, who does hybrid aortic work. just like the way I'm
Oh.
doing right now. But this was about 10 to 12 years ago. And I always wanted to do a fellowship at his center. And it's one of the most sought after fellowship in the United States. So I met him once in a conference. I visited his center. Then second time I visited as an observer. I was there as an observer for about a month. I gelled with all the sub staff and the other fellows. I met a fellow who was already doing that fellowship. So he gave me a perspective as to how he's learning, what hands-on training he's getting.
Okay.
Sometimes a lot of things look amazing from far.
Absolutely.
But then when you go to ground reality, there are situations where probably that fellow is barely even getting to touch a patient. So those things will clear out if you take an observership. And I also got to showcase my knowledge. So that helped me impress upon them that this guy knows something and is just not a dumb spectator. There's a difference between being a good observer and a dumb spectator.
Absolutely.
Right? A good observer is somebody who asks questions at the right time, not interfering in their work, shadow their work, see how the system works, and also see if that is going to suit your needs. And fourth point is to showcase your knowledge and your ideas, and that'll be like, wait a minute, this guy will make a good fellow for us.
Yes, he'll be beneficial to us.
Yes. And then that'll progress to, so that's when, I had an opportunity that to say that, okay, fine, maybe, why don't you apply for the fellowship? Maybe we can consider you. So another thing to remember is you may not get a fellowship straight away. There are a waiting list for 2 years, 3 years in some of the most reputed centers. So you have to apply, then apply again, and then apply again.
Yes.
And the moment your CV becomes familiar, and by then you've done some work that is building on the CV, they will know that you're somebody who's serious about this, because there are people who are just randomly applying for fellowships as well. वहाँ जाके देखते हैं क्या होता है.
And sometimes these guys cancel, and then a slot opens up suddenly, and they don't really have a backup plan, and they may email you. That has happened to me as well.
And
once.
that happened to me as well.
Oh, wow.
So that's exactly what happened. One of the fellows who was in Australia suddenly resigned from his fellowship thing because of some family reasons, and he had to move. And because I had met the mentor in a conference, he remembered my face and my conversation, and he said, wait a minute, there's this guy now, let me write to him. And that's how, I was told that there's a vacancy, would you like it? I said, I jumped on it. So that's how you create opportunities. They don't come to you always. You create your opportunities and you recognize those opportunities. See, it all boils down to the passion and the vision.
Yes. And your homework.
Your homework.
Yes.
You have to spend, I personally asked many people how to do fellowships. Will you get me a fellowship here? Will you get me a recommendation here? But let me tell you, that rarely happens. Everybody is interested in their career. They're busy shaping their career. Not many people have enough time for others. You have to do your groundwork.
And not everybody is recommending easily, because it's their reputation attached as well.
Absolutely.
If I recommend someone to my mentors, then they are thinking Naman has sent me, then this must be a good person. But what if he is not? So I will be very careful recommending anyone.
Absolutely right. Especially if you have not worked with that person.
Bilkul.
Just because you know him doesn't mean he's going to recommend you for a fellowship, and it's not the right thing. Okay. We sometimes tend to take shortcuts. Like, inko bol deta hun, they will go and tell, and then I will get a fellowship. It's not going to work like that. And also remember, the program directors are also very smart and very experienced when it comes to especially Indian doctors. They've had their own stories. If you listen to their stories, how there have been fellows who look fantastic on paper, but they're absolutely useless when they come. There are fellows who don't look great on paper, but when they turned up, they turned out to be one of the best surgeons they have worked with. So there are both way stories. So it's important to not oversell yourself. At the same time, don't undersell yourself. Always overperform. That is more acceptable than overselling yourself.
Right.
And I was not perfect from day one. I went through my own journey as well. I evolved. I learned. I learned to ask questions. I was also perceived that maybe this guy is not interested in the fellowship because he was not asking enough questions. But that all comes from the background you come from. it's also important to never give up
Hmm.
when you're applying to fellowships. If you do not get a fellowship today, you may get a fellowship next year. Maybe this year, that particular surgeon was not around much to teach. You never know. Things
Right.
happen for the good.
Absolutely.
Maybe next year, the person is so hands on and he ended up doing cutting edge work that you were part of the team. I have seen surgeons like that. I know fellow Indian surgeons who are fellows who were part of cutting edge surgery, which happened first in the world, and now their name is attached to that innovation. So always be optimistic. At the same time, don't just be like a vegetable in your while you wait for the fellowship to come. You try to continue to build your CV, strengthen your CV in some form of the other, whether be it talking in a conference or publishing a paper, or at least involving in a research that is accredited by ICMR and other research works. Try to get a scholarship. Anything of this sort is a plus point on your CV.
Now, to choosing a fellowship, there are one or two more aspects I want to ask you about. One is hands-on. What should be the ideal expectation for a hands-on in a fellowship, and what really goes on in fellowships?
See, I
Surgical.
think based on my experience, hands-on is a oversold preposition in most fellowships everywhere. Either it is promised and not given, or you go there expecting yourself to have hands-on in your own head, and then you end up being disappointed because you don't get enough. Unfortunately, even till today, there are very few centers who actually give you hands-on, despite you being the best fellow you can be. There could be so many constraints: hospital constraints, licensure constraints. There could be other fellows ahead of you who have been working there for a long time. There could be safety reasons. There could be legal reasons. So I would say don't rely entirely on a one center that provides hands-on fellowship. If you're lucky, you get it. But go to any fellowship, but with a good program and a reputed center that adds more value as well. That's why it's important to have a good training, basic training, before you embark on fellowships. If you're expecting to learn all the basics in a fellowship environment and you're expecting first time to do I can say like first time to do a CABG in a country not your own, then you're going to be disappointed because they are going to expect you to be able to perform these surgeries by yourself. And one fine day in 6 months, 7 months into the fellowship, you're going to get a day where you're going to be on the right side of the table and they will tell you operate. And if you do not know how to put a basic cannula, basic stitch, think that your fellowship is over. You're not going to get any more hands-on. Right? So it is, be honest to yourself, where you stand, what your skill levels are, communicate it, show your interest, and go through the fellowship. Give it some time.
Yes, actually this happened to me. I used to start the cases before the professor used to come, and one day he was late in Germany. And when I applied the anchors, I was stitching the cuff, and he came and he just stood beside me. He didn't scrub in. He kept observing me, guiding me as well.
Yeah.
But then that was my first case, independent, and it was a great case. And I felt so confident, proud.
Yes.
I was very grateful to the professor. But that didn't happen in first month, of course.
It will not happen. Everybody knows, especially Indian doctors, they do know that they don't get enough hands-on in their own country as well. So I'm not, again, generalizing this. I'm talking from my own personal experience. And it takes a few months, but then the day will come. And not all fellowships are going to be hands-on. Take whatever you get, but make the best of wherever you are. It could be any center.
What about the license, sir? Like in Germany, I could not operate anyways because I didn't have the language and the license.
Correct.
So it took me some extra time to just get my license.
Yeah. The easiest countries, or at least every year rules are changing, but the easiest countries in terms of getting a license and to work as a fellow are Australia and probably UK.
Right.
Okay. And then comes Canada. These are the three countries where high volume people go to train. So they are aware and they take in a lot of trainees as well. They have a lot of positions because it's a huge country, huge market. But countries like US and Germany, these countries have very stringent rules, and USMLE for United States of America. The way I looked at it is, first you be clear to yourself. See, everybody says, I don't know what I'm going to do. I don't know what I will decide once I go there. If I go there, let me decide. Unfortunately, that may work for you, but not in the long run. You're going to again come to those crossroads where you are not sure of what to do.
Absolutely. And the time is wasted.
Correct. Time is wasted. Then, you'll do this fellowship. Then, like, maybe, I'll go to another state. I will do another fellowship. Maybe this was better. I'll come back here. Then, and then before you realize you're 50 years old.
Yeah.
Half of your, or 3/4 of your career is over. I have seen doctors like this.
Absolutely.
Okay. And there is, like, let me give you an example for USMLE or anybody who wants to become a consultant abroad. This is also a very common question being asked. In USMLE, for US, you have to do USMLE. The investment you put into US, having said that, USMLE is a little better now because you do not have the mark cutoff, the percentage cutoff anymore. It's a pass or fail, and then you move on to your interview rounds and things like that. But for me, it was very clear. Now, do I want to invest 1 year of my life studying for USMLE, doing USMLE, and then going there and I want to settle down there? Or do I want to come back? So if I want to come back, then that investing 1 year of my life in just preparing for USMLE while I'm not doing anything here after my super specialty, I looked at it as a waste of time. Okay, so you got to be sure. Now, if you're sure that you look at your future in that country, then you invest that time and try not to come back.
Right.
I mean, this is how I broadly look at it. You may have personal reasons.
Of course,
then
there are
you
exceptions always.
Exceptions are always there.
Yes.
But this is how I look at it. How do you time manage your life? If I have to put it that way. How to plan your career.
Yes. And then the other important question, sir, money. So if you keep on training for a long time, then you are definitely short on money. And your age also becomes more and more. You have pressure to get married.
Yeah.
Then cultural things come into play. What's your take on money in fellowships?
See, personal factors always come into play. So it depends on your financial background, your family financial status. Everybody is different. But what is important is not all fellowships pay you the same. For example, there are fellowships in Singapore where the pay that a fellow gets is not enough to pay the rent of the house. In Singapore. In Canada, there are private fellowships like the department funded fellowships where the funding is so low that it may just be enough for one person to live in a small room and do his fellowship without his family.
Right.
But there are also fellowships in Sydney and other cities in Australia where they pay you so well that you can save and probably come back and build your whole house also. Wow. And probably come back and get married also. Wow. Unfortunately, I've never been in those kind of fellowships, but I've heard of people taking fellowships like that. And I think, so it's important to look at your financial goals depending on your financial background. Scholarships are rare as far as I know. There are centers in India where the department where you're working for funds your fellowship, you go do the fellowship and you come back to the department. So if you're lucky if you have that kind.
Right.
But I'm talking for those majority of the people who do not have financial backup and who do not. You got to plan and be sure of what you want to do. Like, don't take in too much also of a burden that you go there and you start struggling to have a decent meal in a day. There are situations like that. Be mentally prepared. It looks like it's in dollars or euros or pounds or whatever, but you have to adjust it to the inflation there and you have to adjust it to the expenditure there. It all boils down, it equates more or less on the same table eventually.
Right.
If you factor in currency, you cannot convert to rupees and say I'm earning 10 lakhs there. That 10 lakhs, you may have expenditure of 8.5 or 9 lakhs.
Absolutely.
True. If you convert, there
are 1 lakh is for coming back.
Correct.
The flight.
your return flight ticket. That is so right. And that actually has happened to me multiple times where, I had to factor in my return tickets as well.
Absolutely.
So you have to decide. and you know, everybody's life is different. So I would say, look, apart from which center you want to go to train, you also see how much they are offering. There are government funded fellowships, there are your own home government funded or department funded fellowships, and then there are fellowships which pay really well.
Right. Sir, I think we have covered pretty much enough of the fellowships. However, I would like you to summarize the tips to become a successful trainee. You know what I mean?
Yeah.
Like you have landed up this
Yeah.
fellowship
Yeah.
and you have this course waiting for you. What can you do during that course or before that to come out of it with a perfect outcome?
I think the most essential aspect, or my advice is, you have to be humble in the fellowship.
Right.
You got to be willing to learn.
Hmm.
First unlearn
Yeah.
and then learn.
Right.
It is an understated fact.
Hmm.
When you go there, sometimes we think that we come from busy centers, and you know, because we have the reputation that Indian doctors know more, sometimes we end up being a little arrogant, and we think that we know more than you know what it is. But you got to forget whatever you have learned for the time being. It'll all come back to you once you're an independent consultant.
Right.
Okay, but you got to first be humble, unlearn, and then you learn. Okay, and keep the drive going and know your goal. Don't be goalless. Don't think that let me finish the fellowship, then see what I'm going to do. Most usually they are the ones who end up being frustrated and not knowing exactly where they belong.
Absolutely.
Have a goal, know the purpose of your fellowship. It could be 2 points, it could be 3 points, it could be 5 points, and know your end destination.
Great. Well said, sir. Sir, one thing I want to ask, after so many years outside,
Yeah.
why did you come back?
Call me as patriotic as you want, but I felt that you know, there were multiple occasions where I would hear that, you know, especially people in India saying, US may, you know, the treatment is this good, Germany made this good. I was like, you know, there's nothing lacking. We don't have lack of talent. We have incredibly talented people, incredible mentors, incredible institutions. But why are we not looked at this with the same benchmark? So I was very clear that I have to get a global perspective, global training, and bring back that quality to our country and say that we are on par with them, if not better. That was one of my goals. And second, you know, whatever I did or I was able to achieve abroad, it never gave me the satisfaction. I always would tell myself, do it in your country and then we'll see. You know, because India is a challenging environment.
Right.
So if you're able to thrive here, so it was a personal challenge for me that, you know, I have to come back here, build the quality and see if I can thrive or not. And again, you have to have patience everywhere. And I always wanted to come back. And I was clear about it. Again, it's the goal. I knew what I wanted to do. I was very clear that I wanted to come back. See, if you look at things with a foggy lens, everything looks bad to you. But if every country has their own economical challenges, socialist challenges, political challenges. Okay, and India is no different. So are the other countries. Okay, if one thing is good in India, the other things are not good outside. And if one thing is great in there, so the way I put it, all of them are poisonous. You pick your poison.
Yeah, that's a great way to say it.
So this was my poison.
And you stick to it.
Yeah. But poison, not literally, it's not doing anything to me, but it's a challenge, right?
Yeah.
So you pick which one you want, which one suits your needs, your social needs, your family needs.
Yeah.
Okay. You may put your family ahead of you. So maybe that country suits you. Great. But have a goal. Don't be goalless and don't just randomly do things.
Very well said, sir.
Thank you.
So it's really an honor to have met you and to have worked in the same institute as you.
Pleasure.
And so thank you, and really grateful that you took out some time in your extremely busy schedule to plan this and to come on this podcast. I'm sure it helped a lot of people, and it's going to help for people and especially surgeons
Yeah.
for many years, I'm sure.
Thank you. Thank you, Naman. It was
Thank
a
you,
pleasure.
sir.